I'm Christine Sitz, and this is a story of a liver transplant patient. This was created for my N203 palliative care class at UCSF. My motivation for interviewing the woman who I'm going to speak to today is to understand what it was like for her in the times when no one was looking or paying attention. There are turning points in people's lives that go unnoticed, and I find this intriguing. As a healthcare provider, I miss out on these moments with my patients. Time and resources are an issue, and it doesn't help that sometimes I subconsciously detach. People go into medicine to help others. When someone's suffering and there's nothing to be done, you feel helpless. Maybe through shared stories, providers can explore the things we don't have the time to at work and expand our compassion and ability to connect. This is also for the patients in the hospital bed receiving a new diagnosis, those waiting for a transplant, or everyone out there dealing with chronic illness, and for the friends and families of people who are ill to understand a little bit more about what this experience is like. Not everyone is willing or able to physically attend a support group, but I think this is an atmosphere where we can all connect and learn through stories. In this interview, we glance at the intimate aspects of Sherry's challenges and discover what it is that makes her so resilient. Hereditary pancreatitis is a rare inherited condition that causes recurrent episodes of pancreatic attacks from an early age and can eventually lead to chronic pancreatitis. This is where Sherry's story starts. She was born in Clinton, Missouri in 1955. Out of 6 children in the family, Sherry and 2 of her brothers inherited the condition. It had been passed on from her maternal grandmother, but that's all she knows because there was never too much talk about it. Sherry was first hospitalized for pancreatitis at age 15, and she had to learn to manage the condition as there was no cure. Time went on, and despite occasional attacks and pain, life was good. In 1977, she decided to move and start a new life in California. What are some happy moments from your childhood?
I would say probably just playing with the neighborhood kids a lot. I mean, we were just nonstop. We didn't have the computers and all that, and we'd play kickball and baseball, and in the summertime it was swimming all the time.
And you had 5 siblings?
Yes, I was number 4. 3 girls and 3 boys, and it was great growing up in a large family.
What kinds of things did you do in high school? Did you do any sports or?
I did a little bit of powder puff, football, and
Really? Football?
Yeah.
Oh, wow.
Powder puff football and basketball and like the pep rally, and just mostly hung out with friends, go to the games.
What were some of your dreams as a young person?
You know, back then, women were just kind of starting to come into their own and become a lot more independent and working. To be honest, I didn't have any major goals, but a friend of mine got into the dental profession, so I thought, why not?
Yeah.
And it actually worked out for me.
So what made you move to California?
California dreaming.
All the leaves are brown, and the sky is gray, I came for a while.
Sherry settled in California and lived with several girlfriends while working as a dental assistant. In 1986, she met a man named Nick. They fell in love and were married a year later. The couple soon discovered that Sherry was pregnant, and in 1988, their son Nicholas was born. Can you tell me when you first met your husband, Nick?
Yeah. I lived in a condominium across the street. I had a really good friend, Peggy, and she introduced me to Nick. So I invited him to a dinner party that she was going to have. She was going to have her boyfriend, and I was supposed to bring somebody. So I called up Nick and invited him, and we all had a really nice dinner. And I just remember him telling us that any girl that could make him polenta he was going to marry. So I made darn sure I knew how to make polenta.
That's funny.
And he was a little rough around the edges, but he was really nice, and I could tell he came from a really good family, and that kind of sealed the deal for me.
Oh, the polenta was good. She doesn't make it on a regular basis like I would like to have her.
How long did you guys date before you knew you wanted to marry her?
It wasn't very long. 6 months, maybe?
And you knew?
Yeah.
So what day were you married?
7/11/87.
And you were, soon after you were married, you were pregnant with Nicholas, your son.
Actually, whoops. I was about 2 months along, and it was probably the happiest time ever in my life. Well, my adult life. Yeah, I was very happy and excited, and, I was 32, I believe, at the time, and I was actually going to have a child. So I was just really excited about that.
Amidst life's greatest joys, Sherry and Nick's world came crashing down. During a trip to Washington, Sherry became very ill and was hospitalized. A gastroenterologist suggested a pancreatic cholecystectomy procedure and claimed that it would resolve all of her pancreas issues. She and her husband consented. After the procedure, Sherry did not get better. She spent more than a month in the hospital in Washington before being discharged. 24 hours after arriving back in California, Sherry was gravely ill and was brought to the ER. She was immediately transferred to UCSF for higher level care. This young woman, just recently married with a 1-year-old child, was now a patient at UCSF and would remain there for almost 3 months. The procedure she had was making her ill. It was not performed correctly and was causing her liver to fail. Attempts to repair the damage were unsuccessful, and she was placed on a transplant list. She was extremely jaundiced, weighed a mere 86 pounds, and was on death's door. How was your family looking at you during that time?
Concerned. Thankfully, I had a lot of help. My mother had flown out from Minnesota to be there with me. My husband would come with my son as often as they could. It was a tough time.
So you were alone still, even with all that help. You were probably alone in that room for...
Oh, yeah. I was definitely depressed.
Yeah.
Definitely. I was there for weeks to months. I remember the day that this doctor who had redone that surgery came in, and he said that because of what had happened, the surgery that was done incorrectly and everything snowballing, basically, that I was going to have to have a liver transplant. And I remember just being totally in shock.
Were you alone when he told you that?
No, my mother was with me, and as soon as he left, we both just started weeping and holding on to each other.
Oh. Yeah.
So, I didn't, I had heard of this doctor that was the chief of the liver transplant unit, but I didn't think I would be meeting her.
How did you process this news, and what things did you do to cope?
Well, to be honest with you, at first I was kind of, I don't know if you could call it denial, but I thought, no, they've made a mistake. This is not going to happen. But I soon learned that it was, because for the next few weeks I was meeting with the team, then fairly soon, I believe, I was put on the transplant list. I remember at the time, I was just like really yellow. I was so yellow, I was green. I remember it was getting to be like 6, 7, 8, 9 months. And
Since being put on the list?
Yeah.
How much did you weigh at that time?
It was low. I think my lowest weight was 86. And normally, for me, being petite, I never really got too much over 115. I think 120 was the highest I ever weighed. But my stomach was so big because of the cirrhosis liver. It was just getting worse and worse and worse. I was developing different things about my body. My fingernails became clubbed. I don't know what you call it, but your skin, it gets these like white pigment things on it. I forgot what it's called. And Nick started saying, she's really getting sick, she needs to get a liver. Then with his job, we were offered a trip to Hawaii. This was in October. We really wanted to go, and we were going to go. We had made the plans to go, even though I was sick and I was being fed through a tube, and I had to bring all this equipment and solutions and tubing. And
You weren't able to eat at this time?
No, I wasn't.
How long were you unable to eat?
I was unable to eat for 8, 9 months.
Oh my gosh. What was that like?
It was horrible. It was horrible. I remember the aroma of food. I wanted it so badly. And I was on prednisone too. So that increased my appetite.
Oh.
And I was very unhappy about that.
And you're laughing now. Like, what makes you laugh about that?
Well, I mean, it's not laughing. I guess it's my way of coping.
Yeah.
And I remember like crying a lot and trying to eat, and then I'd just go throw it up.
Oh.
And I remember being in a lot of pain a lot of the time. I was very depressed. But I had a son. And I think that saved me.
Do you have a good memory with him during that time? Just you and him? Even though you were feeling sick?
Yes, I had a lot of happy memories with him. He was always the brightness in my life. Oh my gosh, he was funny. He was funny. He was just a real joy.
When you were in the hospital, what things made you feel better and what things made you feel worse?
I remember being, you mean pain-wise?
Just in general, for people out there who are in the hospital or people taking care of people in the hospital.
Well, I think my mother devoting so much time to me. She was a former nurse, and she understood me. She'd been my mother for 30 years. She, just by having her there, was a comfort. And of course, when my son would come, that was always delightful, and my husband, having them. To be honest with you, I know it sounds kind of weird, but I didn't really enjoy having people see me at that state. So I didn't really want visitors, really. I mean, I never let them know that, but I'm just the type of person where if I'm sick and I'm in pain, I don't want to feel like I have to have a conversation. And so the nurses were always very good about that, and it was nice to have the nurses there, They were a real comfort.
So soon after you were married, after Sherry and you had Nicholas, she became very ill.
Mm-hmm.
How did that feel very early on in your marriage?
Yeah, just deprived, not knowing what kind of direction we'd be leading, or it was just a hit and miss thing. You wonder if she's going to continue living, and the only thing that got me through it, I think, was just keep myself busy working on my job, and it was very it was traumatic in that period of my life, because I wasn't sure which direction things were going to end up.
Were you taking care of Nicholas most of the time?
Yeah, and my dad also, he came down and he helped quite a bit. So, but yeah, taking him to the daycare every day, and then picking him up at the daycare, just an extra hour's drive every day, doing that, and then going down to UCSF like every other day, like Monday, Wednesdays, and then weekends we go down. Sometimes we spend the evenings on the weekends. But we got to know UCSF very, very well.
So what's your strongest memory from that time when Sherry was very ill?
Oh, I don't know. The strongest memory is just probably getting Nicholas in the car and going down there and going to cafeteria and just visiting Sherry and just trying to be a family. That was the strongest point, probably.
Did he like going to the hospital?
Yeah, he didn't mind. He was just a little guy, toddler, a year old, year and a half. And he was a trooper. He got in the car and he did what he had to do and helped me out probably too. Gave me some guidance too, and some, organization basically.
Did you worry that she wouldn't make it and that you would be alone raising Nicholas?
Yeah, that's a good question. I thought of it, and I never thought that way. I thought everything was going to work out, and it was just a matter of time, and I was pretty optimistic. She was a fighter, and she knows she had to live for her son, and I think that was what drove her to keep going and to spiritually get through it all.
After waiting on the transplant list for more than a year, Sherry finally got the call she was waiting for. She would be the recipient of a new liver that would save her life. Since her transplant, Sherry has faced over 6 rejections that required hospitalization. She developed diabetes and is insulin dependent. She has had numerous liver biopsies, multiple liver stents placed, and takes 24 pills a day. Side effects of these medications cause immunosuppression, skin cancer, and osteoporosis, to name a few. She sees one of her many doctors at least once a month for various problems and takes antibiotics about every 3 months due to issues with her liver stents. Her health maintenance is excruciatingly challenging, yet each day she gets up and does it again. I have never seen someone take such meticulous care of themselves. She reports good quality of life, and 2015 marks 26 years since her liver transplant. Can you tell me about the day you got the page from the transplant service?
Okay. That was actually in January like 9th of 1991.
So how long did you wait from the time you were put on the list?
I think it was something along the lines of a year and 4 months.
It's a long time to be that sick.
Yeah.
Do you know who or where the liver came from?
I believe it was a 16-year-old boy I think it was an auto accident.
Did you ever find out any more information about him?
At the time, I just couldn't face it. I couldn't bring myself there. I can't explain it.
Yeah.
I can't explain it. But throughout the years, I've thought about him.
Do you have any positive memories while you were in the hospital when you laughed or smiled?
Well, again, I just remember this little towhead kid coming and me with my arms spread and his arms spread.
Your son?
Yeah.
Do you remember a nurse or doctor in particular who made you feel like you mattered? Is there something they did or said that was different than how other people approached you?
I always felt like I was in good hands at that hospital because it wasn't just one doctor. It was a whole team. And they always made sure that I was out of pain, and they always made me feel pretty special. And I don't know if having my little boy there had anything to do with it, but and yeah, there were a lot of doctors and nurses that I really liked a lot.
If you could talk to a medical professional, what advice would you give them?
Well, if in my instance, anytime I ended up in an ER or anything like that, I think they just automatically assumed that I wasn't for real when I would say pancreatitis, because I think they, through their experience, they probably get a lot of people that are hooked on some kind of drugs, because pancreatitis just isn't that common. So they don't really believe you when you say you've got a family history of pancreatitis until you start pulling out the lingo. Familial pancreatitis, the Roux-en-Y procedure. That's one thing I would say to them, is that sometimes you do need to pay attention to what the patient's saying. And I think as a patient, you need to do your due diligence in seeking the right physician for you.
Mm-hmm. What about a person in your shoes? What would you say to them? Someone going through what you've been through.
I would say to adhere to a strict diet of no fats, no alcohol, taking care of yourself, getting rest, exercise, basically those things.
When you were facing the possibility of your death, did you feel any kind of fear, or anxiety, or anger, or did you just shut down, or how did you cope with that?
I never really felt like I was ever going to die.
Really?
Yeah. I just remember looking in the mirror and saying to myself, you're going to get through this. I just never gave up. I wanted to be the one that was going to raise my son along with my husband, and I just didn't ever want to leave him without a mother. And also, just for my own self, I knew that I was going to be okay.
How did this experience impact your sense of identity? Do you feel like your self-worth was affected by it?
I've gone through ups and downs about that, and I've gone through depressions, feeling kind of worthless at times, but it usually doesn't last too long. I usually pick myself up.
What things do you like about yourself?
I think I'm a compassionate person. I try to get along with everybody. I think I'm a good wife, mother. I like to be a good friend.
Do you think having some self-worth is motivating because it makes it easier to take care of yourself?
Sure. And I have a lot of family members that I look up to, and I just try to be a good person and do right with the world.
What was the most intolerable aspect of this whole journey? The thing that even today gets underneath your skin?
I try not to hold any grudges or anything like that, and I don't. The one thing I can say, and I don't think it really gets underneath my skin, but I always wanted to have another child. And I probably could have at one time, but I didn't want the risk with all the different drugs.
The gene that causes hereditary pancreatitis in your family, did it stop with you?
No, unfortunately. And I remember when I brought my son to the doctor one of the first times after the hospital, after I'd had him, I asked the doctor, I said, what are the chances of him getting pancreatitis? And he said 50-50. And then, unfortunately, I started seeing signs when he was just, I think he was about 9 months old, and he was having some, I could tell he was having some pain in his abdomen. And I just remember him whimpering and laying on the floor with his little rear end up in the air, trying to get comfortable. And I knew.
Because you had gone through that yourself.
Yeah. You know, you were asking about what's gotten underneath my skin. And I would have to change that. I would have to say that that is the one thing that I wish I could change. You know, I can't, unfortunately. Because I can take it, but I don't want my child to take it.
Thanks for sitting down with me today.
Sure.
Do you remember her being sick when you were little?
I paused because it's tough to say. I was extremely young at the time, and I just thought it was kind of a usual or normal experience to go visit my mom in the hospital. Not that it happened to everyone, but I never actually thought about her being sick or the possibility of fatality with my mom.
Do you remember what she looked like?
It was just my mom. It wasn't like because she was jaundiced, I had this idea that she was someone else or she looked different. She always looked the same to me. So at that point in time, she was always just mom.
Did you ever worry about your mom?
It's hard because I have a lot of emotion toward my mom now. So she was always there to me. So it wasn't like I missed this huge part of my childhood with my mother. Felt like she was always there.
Do you worry about her now?
Yeah, it's like my number one thing.
What do you worry about?
She's pretty much in me 100% of the time. And we talk about it all the time because we'll talk about an experience and we'll say, oh, what were you thinking in that moment? Me too, no way. Like, that's exactly the type of feeling that I was thinking, or the reference point that I used in that situation.
What kind of person is she and what kind of person are you?
We were best friends. Like, we spent our entire lives together. So it was actually a gift to me that my mom had her illness because it allowed her to spend more time with me. She was, when I was really little, walking me to school every morning, picking me up, cooking dinners. Like, I can remember every minute of every day that I wasn't either at school or some sort of sporting event / practice. She was always home. So to have that was very comforting.
Why? So she was home because she was sick, or she was home because...
No, she was home because it was too stressful for her to hold a job. Not that stress alone, everyone has stress, but for her, stress brings up pancreatitis. And so for her to go back to work would have been unfair to a lot of people. It would have been unfair for the person or people she worked with. But that's a battle that she had throughout her life. Not being able to work. A sense of self-worth comes into play. So even those are conversations that her and I had with one another.
What about your future children? Do you worry about this hereditary pancreatitis being passed on to them as it was to you and to your mom?
I do. I do and I don't. So I can only imagine what it's like to see your infant child curled up in the fetal position crying, and you know exactly why. And there might have been something you could have done about it with genetic testing. But at the same time, it's brought so many good things in our life too.
Like what?
My mom could be home with me. If I didn't have pancreatitis, maybe I'd be an alcoholic and I'd be extremely overweight, or, you know, and just in a much more different situation than I am now.
Since we're at your mom's house right now, what did you and your mom do this morning?
Oh, sometimes I like being the center of attention, so... And my mom enjoys me there, but we went to her dance exercise class. And I was one of probably I want to say 45 women in there. This entire gym. Not a single other male in the house.
And how did you feel at this class?
Normal. Totally normal.
Not every 27-year-old male would go to his mom's dancercise class with her, but it seems like you guys have a really fun time just being silly together.
Yeah. We were doing like some pumping of the arm motion, like you're at a club almost. And I turn over to my mom and I'm like, I give her that face, like, yeah, check me out. While I'm waving to Susan right next to me and Nancy to the right.
Did you make her laugh?
Yeah, I made her laugh. That's my favorite thing to do.
What do you think has made you so successful in managing your health? Because 2015 was 26 years since your transplant.
26.
Did you know that?
Oh, gosh, I quit counting. I think having the right doctors, adhering to their recommendations, diet, positive outlook, and just taking care of myself, just getting sleep, trying to live a stress-free life. And I think supplements too. I think there are certain supplements that people can take. Always get your physician's okay, but I think that those have also helped me, and I think they've really helped with my immune system.
So can you walk me through your routine, your day-to-day?
Okay.
Walk to the kitchen here.
In the mornings, unfortunately, I have to stay kind of close to a bathroom because of the different surgeries that I've had. Not to be too graphic or anything, but trust me, I need to stay close to a bathroom. And so later in the mornings, I usually get my meds ready. I usually read the paper in the morning and do a crossword, get my mind working a little bit, start working around the house a little bit, and then I start on my medications. And to make things easier, I put everything on a Lazy Susan, and I take all my vitamins and all my medications and get them ready for usually 2 days, because there's so many of them. It's just too many pills to deal with. But I end up taking probably 12 pills or so in the morning and 12 at night.
So 24 pills a day.
Yeah, I'd say something like that.
Wow. So when you travel, you need to take all these with you as well.
Oh yeah, that's a fun thing to do. I have these little tiny Ziplocs. They're called Easy Dose, and those come in really handy and for traveling. And I, how many days I'm going to do, so I'll just line them all up on the counter and put them in all little bags.
So what medications in particular give you trouble?
Trouble?
Or do you have any side effects?
Not too many, but I think sometimes the blood pressure medication that I take is, it can kind of sometimes make my heart flutter. But other than that, I don't really notice too many. But the medications, I can have some reactions in different ways. Like I've developed different skin cancers because of the immunosuppressants that I have to take on a daily basis for the rest of my life.
And you take insulin before every meal too, right?
Yes, I have to take the insulin before I eat and before I go to bed. I check it usually at least 3 or 4 times a day.
Your blood sugar?
Yes.
So you're still divvying up your meds here.
Yeah, and I think I'm done.
Okay. How would you describe life right now?
Life is good. Yeah, I'm very happy, and although I'm a little nervous about it, we're going to be taking a European trip.
Oh, wow.
And so I'm looking forward to that. I'm a little apprehensive about it, a little nervous about it, because I'm going to have to be well armed with all my medications and everything, but I'm really looking forward to that.
And what about in the future? What sort of things do you want to do in the future? Things that you look forward to?
I look forward to attending my son and daughter-in-law's wedding and being a grandmother, and basically those kinds of things. Family.
I cannot help but be inspired by Sherry. Her smile and sense of humility appears through even the darkest of times. When I asked her if I could share her story for my project, she actually thanked me for thinking of her. I hope you all enjoyed getting to know this incredible woman, and thank you for listening.
Won't you stay with me? 'Cause you're all